am born and raised in Puerto Rico, so I come from a very machista society. One of the main cultural challenges that I see is dealing with one's sexuality. And now we can protect our bodies, we can protect our partners, and we can finally come to ending the HIV epidemic. We can change our narrative. I'm Damian, I take PrEP, and I'm ready to prevent HIV.
Afternoon, everyone, and thank you for joining us for this afternoon's Live with Leadership session. We had some technical difficulties with some of the links, and so some of you have entered into this conversation and it shows you as Leisha McKinley-Beach. We know that not all of you are her, so if you want to change your names, at the bottom of the screen, if you click on the participant list, you can hover over your name and click on those three dots and change your name back to what you are. The instructions will also be in the chat, so we apologize about that, but thank you for joining us. And with that, I'll turn it over to Harold.
Thank you, Anne. And again, good afternoon, everyone. And today at our Live with Leadership Talk, we have the real Leisha McKinley-Beach, community advocate and public health consultant, who's going to talk to us about, give us an update on EHE, what she's been doing in the community. And we're going to spend some time talking with her about that and the plan to end the HIV epidemic in the United States. Part of this initiative that is being led by the Office of the Assistant Secretary involves work with our HHS partners across government, but also working with local and state and county officials, as well as the community. And so Leisha's going to talk to us a little bit about her community work in trying to end the HIV epidemic within the next 10 years. So we're talking about bringing it down to 3,000 or less new transmissions. So, and we can do it, because we've got all the skills, all the tools. We just need to involve the community and apply ourselves a little bit differently. And we also have additional federal resources to be able to do this work. So, Leisha, tell us about what you've been doing in some of the communities you've been working in.
First off, Harold, thank you so much for inviting me to share this time and space with you. Although we are not in person, I can say from day one to this moment with you, it really has felt like a family reunion. And so I am truly honored to have this dialogue with you. And thanks to Mac and Paul for continuing to allow me to come and just share my Southern stories during USCHA. You know, Harold, one of the things that I'm certain none of us had planned for as we were ushering 2020 in on New Year's Eve, that in just a short while, we would be in the midst of a pandemic. And even with COVID, HIV work did not stop. And it is amazing that, you know, I felt very privileged to have worked with EHE planning groups across the South in Mississippi and Pinellas County, Florida, and Georgia and Orlando to continue the work. And a lot of them ended up having to transition from our traditional, you know, in-person, by the lunch, you know, and models to a virtual platform. And what was that going to look like in terms of continuing to engage the community? And so I commend those who didn't delay, didn't stop EHE work this year, but continued to move forward because our communities deserve it.
Thanks for that. And you talked a little bit about, even during this time, sort of doing the virtual meetings, and you facilitated some of these sessions. So how did you all, and you talked about some of the work you've done in Mississippi and Georgia and Pinellas County, Florida. How did you involve or let the community know that these meetings are happening, since you weren't doing the traditional hotel and the ballroom or even flyers at aid service organizations during COVID-19? What did that look like?
And so, Harold, let me just say, this became an evaluation, quite honestly, of our health departments who were leading these efforts, if they were truly connected and engaged with their communities. Because those who were didn't miss a beat, right? So we just changing the platform. We're not in person, we're now shifting to this virtual platform. And those who were not have experienced the challenges of how you bring folks to this space. And I can just say, even with Pinellas County in particular, one of the things that they did, as we realized that we were going to have to transition to a virtual platform, they were very intentional about ensuring that the folks who showed up to those in-person meetings, that those were the same people that would be engaged and committed to this virtual space. So what are we going to have to do? Well, we're going to have to change the content a little bit of some of the meetings that have been planned. We're going to now focus on things such as telling our history, right? And so in those communities, folks were going to show up because there were Black historians that were sharing the story, right? More so than those who were framing data around what HIV looked like in those areas, because the people already know. Facilitating dialogues about where do you want the EHE resources to go. So now community had an invested interest to come on and be a part of the process, because we're talking about a financial investment and we get to have a say in that. And then even in Mississippi, and I do hope that, Henry Fuller and his team is on, because they had done something in the virtual space that had not taken place in the physical space. And that was pulling together Latino leaders in Mississippi. And so they had their first Latino leaders consultation about what EHE was going to look like for that population. So I think it caused us to start thinking not outside of the box, but thinking as if there wasn't a box, and ensuring that we continue to bring this opportunity of innovation into our virtual space.
I think that's great. And one of the things that I heard you say that I think is really important is that many of those jurisdiction leads, those public health departments that were already connected to the communities, just had to change the platform in order to make this shift. But it also sounds like you changed some of the content for the meetings. I like that piece about sort of including the history, not just focusing on the data, but that history piece of how did we get here with the epidemic in some of these communities and sort of what led to it. So I'm going to come back to that. But one of the things that you said that I think is really important also is being able to call in Mississippi, call some of the Latina leadership together and to the table. Can you talk a little bit about how you've seen some of the coalitions come together for women of color around the EHE space, and talk about that a little bit for us as well?
So Harold, I'm actually going to use this opportunity for a moment to just talk about what you've asked, but also talk about another ask. And a part of that ask is, I can sum it up into two words, and that is her plan. You know, that we have got to include, as a part of this EHE platform, there has to be a plan spelled out for Black and Latina women. When you look at, uh, we represent 75% of all of the women cases in this country. So ending HIV for us means also ending HIV for babies, and recognizing that this is not an issue in every jurisdiction, but there are still jurisdictions in this country who are seeing vertical transmissions. And I, want to shout out to the Florida Department of Health, because they have an initiative that is on the street right now that's called the Targeted Outreach to Pregnant Women. And so those type of models continue to look at how we eliminate HIV, oftentimes for populations that are not at high priority for all of our jurisdictions. I also think, and this is, a call to action for pharma, that although many of the commercials and things that we have seen in terms of prevention strategies, one of which that gets called out in EHE, pre-exposure prophylaxis, what we have seen has been brilliant for some populations. What we have not seen is that same commitment and effort for cisgendered women. And so being able to invest financially in commercials that reach the masses, so then women know that these prevention tools are for them as well. And that not only are they for them as well, but they're also for women who are over the age of 50. And I think that has now become my own personal platform, as my AARP card is probably in the mail now. Don't forget about us. And that there are groups, particularly across the South. And I know that our participants have access to, I think, the chat feature of the Q&A. I'd like for you to list those groups so that HHS is aware of women's groups that are continuing to raise awareness and build plans and focus on women, across your jurisdictions. In Atlanta, we have the Atlanta Black Women Leaders on PrEP. Nationally, we have the Positive Women's Network. Florida has the Sisters Organizing to Survive. There's a young lady, and Harold, you probably would have to research just like I did. There's a young lady in Miami. Her name is Miami Tip. She is from the Love and Hip Hop franchise in Miami, and she is interested in being a spokesperson for PrEP for women, so that then women get an opportunity to see that there are individuals who look like us, right? From all shapes and sizes, all ages, that have made this a choice as a part of our prevention strategy. And so I think that it is so important that we not lose sight of, there is an equity across this EHE planning and implementation process, and that jurisdictions need to also uplift women as we are talking about these innovative opportunities that we now have.
Thank you. Thank you very much for that, Leisha. You've given us a lot of great ideas, some things to think about. And I would also encourage us as we need to break down the silos that we've sort of created around this disease and within our communities. When we're thinking about trying to reach women and we're thinking about them in terms of PrEP, every gay man that I know has a mother, a sister, an auntie, a grandmother that's important to them as well. And so if we can reach that woman with that information, she is undoubtedly going to share it with the gay MSM that is in her life, especially if she knows this is important, life-saving information. Because like we care about them, they care about us. There was always
Absolutely.
a mama, a sister, an auntie who meant something there. I know they've done that in a lot of the PEPFAR countries, but I think we can do more of that, especially as a way, like you're talking about bringing our communities together.
Oh, absolutely, Harold. Yesterday, one of my sons was giving me a shout out on Facebook about there was some technical difficulty with their USCHA presentation, and they were trying to get it fixed. So I sent them a message. Y'all know this. You've been living this. Just go ahead and talk about it. Right. And so, they were saying, thank you for that. But Harold, as an elder, that's my job. Right. And so, and as we begin to uplift this new generation of leaders, they're not for tomorrow. They are right now. They're in the here and now. And that's one of the beautiful things that I've witnessed with this EHE process in 2020. Names that I have, called out from Mississippi, and Darius Lightsey in Pinellas, and Justin Smith, and Daniel Griffith in Atlanta. And I could go on and on and on. Those aren't names that we always hear. Right. And so this has been an amazing opportunity for us to bring this young Black brilliance into this space and allow them to uplift strategies and things that they know will work for our community. But there are also things that we're going to have to do to help ensure their success. And one of those things is that as we continue to talk about ending HIV, we cannot do that without including both political and social determinants of health, right? Because before there is a celebration about viral suppression, we have to address all the issues that got us to the point to need that word as a part of our terminology anyway. And so if we're not talking about, unstable housing, and if we're not talking about racism and declaring racism as a public health crisis, not just in our words, but also in our deeds. If we're not doing that, then we're not giving the foundation that we truly need in order to end this epidemic. One of the things that I have heard over the past day that I started raising awareness about a decade ago, and that is the infrastructure and the systemic failures in us trying to achieve ending the HIV epidemic. And where there is no balance of power between community and government, as we talk about these EHE models, we're not going to see the desired outcomes until that happens.
The real Leisha McKinley-Beach, thank you. We had a couple of questions. I think we are out of time or almost out of time to be able to get them. One question that I do, where can we get more information about the Atlanta Black women's leaders on PrEP and their work? Can you give us that quickly?
Sure, you can email me at Leisha McKinley-Beach at gmail.com. to find out more information about the monthly meetings of the women. Right now, one of the things that the group is working on is where are the sites in Atlanta where a woman can access both PrEP and gynecological services. And just because we are metro, don't make the assumption that there are many options, because there are not. And so it's things like that, Harold, is our conversation was when we came on about what are some of the local investments? What are some of the local strategies that we need to be encouraging these jurisdictions to focus on? And that is definitely one of them. And Harold, let me say this, because I think we're over time, and my 5 minutes of fame has now come to a close. But when there was the announcement that you were now serving as the executive director in this position, can I tell you that the first thing that came to mind for me was that you are a dream manifested. That in order for this to work, that there has to be leadership that understands the struggles and the culture of those communities that need to be uplifted. And what brought tears to my eyes was a month ago when you took the time with those young leaders in St. Petersburg and just shared Harold Phillips, not the executive director, not the HHS lead, but just Harold. And I sat back like a proud mama, just watching what now your role and my role has become as elders. And that's sharing the story, uplifting them, and getting them prepared to end this epidemic, lead us out of this wilderness. And so thank you for that.
Thank you very much. Thank you. And thank you for sharing your insights with us today. We might have to have another one of these conversations in the future, because I feel like there's so much more that's in you that could be beneficial for so many of the communities that are looking at these issues. And I knew you would be great and also inspiring. So thank you so much. For those of you who need additional information on EAG, please check out hiv.gov, where we continue to update you on our progress with EAG on moving forward with this federal plan. Also, it will lead you to the AHEAD website, where you can get additional information as well as EAG success stories. We've been posting those as well, and data on the 6 indicators for your jurisdiction that will tell you where you are, as well as the 2015 and 2030, 2020, 2017, 2015, 2030 targets and indicators as well. As part of the Ending the HIV Epidemic Initiative, the Plan for America. Also, please continue to enjoy the conference. This evening, we have another Live with Leadership, where we are featuring Paul Kawada, Executive Director, the man with the plan for turning the United States Conference on HIV/AIDS virtual, and Ace Robinson, his Director of Strategic Partnerships. So that is at 6 o'clock this evening. So please join us for that as well. Enjoy the rest of the conference. And Leisha, thank you. And thank you for everything you both doing for communities and also on a national level. It's been great talking to you. Thanks.
Thank you, Harold.